HRT is talked about so much. Can you tell us what is it? What is HRT? How would I know if I need it?
Okay, so hormone replacement therapy or hormone therapy is replacing the hormones that we lose as we age. So, really, that's basically estrogen and progesterone for women, some testosterone and testosterone for men. How you personally would know if you need it as a female is that you would be starting to experience hot flashes, night sweats, some vaginal dryness, sleeplessness at night, maybe some brain fog, and just maybe some irritability and just feeling off. You would really be starting to be moody and just like maybe irritated with people and just not feeling yourself anymore. And menopause itself is defined as 1 year without your cycle. But before that, the gray zone is really perimenopause, where you start like not having cycles really regularly and you start to have some of these symptoms already. And people really start to say, oh, it's nothing, you're fine, you're fine. And you're really not.
So if I start taking hormone replacement therapy, does that all go away?
It depends, you really will have symptom relief, but it really depends upon what symptoms are bothering you. But most women find a lot of symptom relief when they take estrogen and testosterone treatment.
And is it a pill that I start taking?
Um, okay, so they come in so many forms, and it really depends upon the patient. So I will say progesterone tends to be a pill because it's not absorbed any other way, although you can insert it vaginally and you can wear it as a patch. Estrogen can be a patch, a pill, a cream, a gel, a pellet. Testosterone tends to be a cream, a gel, or a pellet because it's not very well absorbed orally. So it really is curtailed to the patient, and it really depends upon what the patient would like to use.
Okay, so when a patient comes in the office, can you walk me through the process? What
Oh,
happens?
absolutely. So what they do is if they really feel like they're symptomatic and they are questioning what they should use or shouldn't use, or if they're a candidate for hormone replacement therapy, they call the office. My staff walks them through a process where they will give us information like a new patient packet, they'll do labs. I take in and read all that information. And then if I think that they are ready to come in, because sometimes they're not ready yet, because if you do it too soon, then that's not good either, because then you're not actually going to feel better, right? So then they'll come in for a consult and I talk to them for a good hour and try to figure out what their symptoms are, what their life is doing, what their situations are, what their work is, what their lifestyle is, because really it's not only your biology, but it's your psychology, like what's going on in your head, your mental health, things like that. But it's also your sociology, like what's going on in your life right now. Are you taking care of sick parents? Are your kids going to college? Like,
Mm.
what is going on with you? So it's a biopsychosocial model that we follow here to see what is right for that person. What are they worried about? What's their medical history? Like, all the things go into what that patient gets treated with.
Wow. Your whole practice, you specialize in HRT. Why did you choose that?
Oh, it's interesting. So I've been a gynecologist. I graduated residency from Jefferson in 1995. And then, no, I graduated from medical school in 1995. Hold on, I don't know my years. And then I graduated residency at Jefferson in 1999. And then I've been a gynecologist ever since then. And really, I felt that there was gap in our knowledge because we don't learn a lot in medical school about menopause. Then even in residency, we only learn, deliver babies, deliver babies, deliver babies. So when I was in my 30s, I saw all these women suffering from menopause symptoms, and I really didn't know what to do with them. Like we really only had, Premarin and some patches and things like that. And then in 2002, the Women's Health Initiative comes in and they go, throw out base estrogen. No, you're not allowed to have that anymore. And then they would come and say, well, I'm having hot flushes and night sweats and I can't do anything about it. And I'm like, oh my goodness, what am I going to do? So that's what prompted me to go, I need to know more. I need to find out more. So I, kept going and going and going and learning from the Menopause Society, learning what to do with these people, alternative medicine, other things like, lifestyle changes, things like that. And then I ended up moving on into this and just specializing in menopause. My friends always kept saying, you're going to specialize in menopause someday because you're going to help us. So there you go. Here I am 11 years later. And it's been rewarding. I can't even tell you how rewarding it's been to help change people's lives.